Your physician has recommended that you have a colonoscopy. A colonoscopy is a fairly routine procedure for interior examination of the colon and is performed safely on millions of people every year. Here at the Endoscopy Center at the Riverbend Pavilion, our highly trained staff will make sure that you are safe and as comfortable as possible. In preparation for your colonoscopy, it's important that you follow a series of steps, and it starts 1 to 2 weeks before your procedure date. A staff member will call you to confirm your appointment date and time. We will send in a prescription for your prep kit to a pharmacy of your choosing. During this call, please let us know if you have a history of cardiac stents, organ transplants, fluid in the abdomen, heart grafts, or if you take Coumadin or aspirin. In general, if you take aspirin, you will stop taking it 7 days prior. Ask the nurse what blood pressure and heart pills to stop taking on the morning of the procedure. Arrange for a friend or relative to remain in the waiting room and to take you home after the procedure. Without an escort, we will not be able to proceed. It's okay to take a bus or taxi home as long as you have an escort, and we can provide a referral for a medical taxi if no one is available. Plan on being here with us for approximately an hour to an hour and a half. 5 days before your appointment, discontinue any iron supplements if you take them. Also, stop any foods containing seeds, nuts, or popcorn until after your procedure. Purchase the prescription prep kit from the pharmacy. Some insurance companies may not cover this. Out-of-pocket costs may range from $25 to $60. If constipation is an issue, you will need to buy bisacodyl tablets and magnesium citrate. These are over-the-counter medications and will be taken 2 days prior to your procedure. 3 days prior to your appointment, if you take Coumadin and have been instructed to stop, this is the day. On the day of your exam, 1 hour before your appointment, you must check in at Peace Health Laboratories on the first floor of the clinic for a finger stick ProTime. A nurse will send the order to the lab ahead of time. 2 days prior to your appointment, stop taking all anti-inflammatory medications such as Advil, ibuprofen, Aleve, and naproxen. It is okay to take Tylenol. You can continue to eat normally except for foods containing seeds, nuts, or popcorn. As mentioned earlier, if constipation is an issue, take 1 bisacodyl tablet at noon, another tablet at 1 p.m., and at 6 p.m. drink 10 ounces of magnesium citrate. On the day before your procedure, take all prescribed medications as normal, unless you are diabetic. Oral diabetic medications must be stopped the day before and the day of the exam. Insulin medications are taken at half your usual dose on the day before your procedure, testing your blood sugar 4 times. Call us if your blood sugar level is greater than 300 or less than 100. If it is less than 100, drink a glass of juice. The day of the procedure, hold your morning insulin and bring it with you to your appointment. The day before your exam, you will stop eating all solid foods and drink only clear liquids. Drink at least 64 ounces of fluids throughout the day, but please avoid red or purple drinks. Clear liquids include coffee and tea without milk, broth or bouillon, Jell-O, juices without pulp, Gatorade, and soda. Although not a clear liquid, you may have Boost or Ensure, but no more than 2 cans, or Glucerna if you are diabetic. In the morning on the day before your exam, take the HalfLytely jug from the prep kit and add water to the fill line. Mix and put in the refrigerator. At 2 p.m., take 1 bisacodyl tablet that is included with your prep kit. At 6 p.m., begin drinking 1/2 of your chilled HalfLytely mix, 8 ounces every 15 minutes. You can slow down a bit if you begin to feel nauseous. Walking around will also help with nausea. If taste is an issue, sip the prep mix through a drinking straw. Put the other half of the prep mix back in the refrigerator for the next morning. On the morning of your exam, don't take any medications except beta blockers. Starting 4 hours before the time of your check-in appointment, drink the remaining refrigerated prep mix, drinking 8 ounces every 15 minutes until finished. You can continue to drink clear liquids, but you must stop all fluid intake 2 hours before your check-in time. It is okay to brush your teeth, gargle with mouthwash, and use chewing gum and breath mints before you come into your appointment. The Endoscopy Center is located on the second floor of the Riverbend Pavilion. From the Pavilion parking garage, follow the signs to the elevators. Enter from the Pavilion lobby and take the elevator to the second floor. When you come for your appointment, dress comfortably and please leave all valuables at home. Once you check in, you will change into a hospital gown and get comfortable in a bed, where a nurse will record your health information and take your vital signs. An IV line will be started for the sedation medication that will relax you during the colonoscopy. If you are diabetic, we will also check your blood sugar level to make sure it's stable following the fasting and other preparations. Shortly, your doctor will visit you to discuss the procedure and answer any questions you may have. Not long after that, a nurse will come to transport you to the procedure room. Once inside this room, you will see staff making preparations for your colonoscopy. Soon you will receive an intravenous sedative, and before you know it, you'll find yourself in the recovery area, drifting in and out of wakefulness for a while. Your family member will come to your bedside to be with you, and your doctor will join you when you're alert enough to listen to the report of the examination. You and your family member will receive the procedure report and information concerning your discharge and recovery. Because of the sedation, you may forget some information, so most of the important items will be written down. Then you will change into your clothes and be driven home. The effects of your colonoscopy procedure will keep you at home for the rest of the day, but in most cases, you'll be able to resume normal activity the following day. We at the Peace Health Medical Group's Endoscopy Center are dedicated to improving the health of our community, and we make sure that each and every patient receives the best care possible.